Welcome to all. Now we are going to see the main important kingpin rubric of sulfur. How the two rubric fitted in most common cases of acute illness. If we go to the repertory, take the symptom of quiet want to be desire, repose and tranquility, and delusion, injury, injured being. When you get the combined rubric, the only drug covers the both rubric is sulfur. So now I would like to share about the cases of sulfur, how these rubrics exactly fitted in most common cases of acute. So here the delusion, injury, injured being, mind, quiet, want to be, desire, repose and tranquility. So before going into depth into the rubric, we should know about the exact meaning of each and every word of the rubric. So here the delusion. How you interrupt the rubric into the delusion is a patient's feeling, how he feels, how he think about the problem. So his own feeling, his own imagination. His feeling is a delusion. We can simply take it that patient feeling is delusion. His own feeling, his own imagination. First we have to know about the delusion, injury, injured being. What is meant by injury? Many times the injury is the patient suffering and patient pain, hurt, accident, attack and so on. So the injury is many times the patient suffering and patient pain. We can take the direct meaning from the dictionary. We can apply it in every words of the patient. We can easily apply. Next meaning is injured being. Injured being is a continuous tense, present continuous tense. The patient continuously suffering. The patient would tell that in past 2 to 3 days, I am suffering from headache, continuous headache. In past 2 days, I had fever, continuous fever. So here it is a continuous suffering. Whenever the patient would tell the continuous pain, continuous suffering, we can take delusion, injury, injured being. Next rubric is quiet, want to be, desire, repose and tranquility. So quiet is a calm state. The patient does not want to speak. Patient is reserved. While suffering, patient not want to talk. Patient keeping calm and reserved. Repose is rest. The patient want to just lie down on the bed. Tranquility is the peace of mind. There is no stress at all. Free from stress. Free from thinking. The patient want mental rest. The quiet desire, repose, tranquility means the patient need physical rest. Just lie down the body, lie down the bed, and mental rest. That is a peace of mind. So, how the patient would tell that symptom? The patient, while suffering, just lie down on the bed, not want to talk to anybody, and just avoid from stress. Just patient want to sleep. The patient would tell the symptom like that. Doctor, in past 2 to 3 days, I had no sleep. Just give the tablet for sleep. Sleeping pills. We can take the rubric. Quiet, want to be, desire, repose, and tranquility. In combined words, what would be the patient words? The patient, many cases of acute fever and acute headache, any type of fever, it may be the acute viral fever, any acute bacterial fever, typhoid fever, malarial fever, patient would tell the symptom. I am suffering from fever. 2 to 3 days I am suffering from continuous fever. I am suffering from continuous fever from past 2 days, continuous fever, continuous headache. The pain is intense sore as if injured. The pain is sore from joint to joint. The pain is continuous, doctor. I'm suffering from headache, continuous headache. The patient would tell the symptom. It is common patient version. We can take the rubric within 2 minutes of entry point of the passive case taking. If you ask the feeling of the patient while suffering, the patient would tell, I want to lie down on the bed, I want to sleep, not want to be disturbed. I just lie down on the bed and I want to sleep. That is a common patient version we can see in day-to-day practice of fever and common acute illness. Easily fit the rubric of delusion, injured being, and quiet want to be, repose and tranquility. Many cases of acute diseases, the case will finish in 2 minutes. We can take the rubric into 2 minutes. We can get the rubric and prescribe the drug. Many times I advise the patient to wait 5 minutes and give you a review. We can get the result within 5 minutes. The patient will tell 50% of pain is reduced. We can confirm the drug on the spot. We can give the result on the spot with simple prescription of sulfur. So thank you. If you have any doubt, just type it in comment box. Don't forget to press on the top bell button for time to time intimation. In this channel, I would like to share my experience in to promote a simple homeopathy in beginners. What all the failures, what all the struggle I have faced in my clinic. So I want to promote to tackle the difficulties in the practice, and we can easy prescription. So I would like to share with you in future videos. Thank you.